MaKayla Colbert, and I'm going to talk to you guys today about verbal and nonverbal communication in autistic children. Imagine calling your child's name many times, and one day you notice he or she does not answer to their name anymore. Your child is at the age of 16 months, and you begin to wonder, will your child ever answer to his or her name again? You will also wonder, will you ever hear the words, "Mommy, I love you" again? It seems as if your child's life will be changed forever. Many people have heard about the rising occurrences of autism developing in many children. But the real question is, why does autism have an effect in children's communication with other people? By the end of my presentation today, you will know what autism is and how it affects children and the way they communicate. First, I'm going to discuss with you what autism is and its effects on children. Based on the National Autism Association Autism Facts, autism is a bioneurological development disability. This disability will usually appear in children before the age of 3 years old. Autism impacts certain development areas in the brain. These areas include social interaction, communication skills, and cognitive function. Typically, subjects with autism will usually have a difficult time with verbal and nonverbal communication. About 40% of children with autism do not speak, and about 25 to 30% have some words by 12 to 18 months. Then, they will lose those words. Other children will not speak until later in their childhood. According to the National Autism Association, researchers are not sure of the causes of autism, but they have many theories as to what could cause this development disorder. Some of the many possibilities are limited prenatal vitamins intake, parental age, genetics, and vaccinations. Researchers think that vaccinations may be a cause in triggering autism in some children. Some researchers also think that women who have children over the age of 40 are putting their babies at the risk of getting autism. Autism affects 1 in 88 children, and it is assumed that boys are 4 times more likely to have autism than girls. People with autism vary. No two people with autism are alike. That was just some background information on autism. Now I'm going to discuss the communication skills in autistic children. According to the Hannah Center, communication development happens more slowly because of the sensory challenges associated with this disorder. Children with autism seem mostly interested in environmental sounds, like the whirring of a fan or the sound of a vacuum. Children with ASD do not naturally imitate. They will either not imitate at all, or they will imitate whole sentences known as echoes, without actually understanding the meaning of what they are saying. On the Hannah Center website, children with autism or Asperger's syndrome may use long sentences and a very extensive vocabulary. Most children will pay attention to body language, tone of voice, and facial expressions, but children with mild autism have trouble tuning into these things. They will also find it very difficult to socialize and make friends. They also have trouble with empathizing and seeing other points of view. The best way that parents can help their children learn to communicate is having them around people with whom he or she has a strong bond and in environments in which they are most familiar. Children with autism learn and communicate best when they have structured schedules with the right vocabulary. Children will talk and begin to think differently. They will begin to see the importance of listening to other people's ideas. Children are very much affected by autism. Children with autism will develop slower than most children. It is very important for parents to have patience with their child. Now that I have given you all this information about autism, let's think back to your 16-month-old child. Do you think that your child will answer to their name again? What precautions will you take as a parent to improve their communication skills? Thank you.